So my next question is to all three of you. I believe that your three organizations are really important and essential in this constellation of children's services. Um, have have you experienced a drop in charitable donations since the crisis started? I think you're all charities and not-for-profits. And if so, has the government support, to what extent has the government support enabled you to carry on your work? I know the Kids Help phone line has received a lot of support for special measures, but I don't know if the support extends to keeping not just a roof over your heads and staff employed through the emergency wage subsidy program, but enabled you to deliver your services in a completely new context.
Maybe I
So
can
perhaps
start.
Ms.
Yes.
Grunwald, you'd go first, then we'd go to Sarah Austin and then Ms. Hay.
Sure. We do not qualify for any of the subsidies that the federal government has announced to date. Our funding absolutely has been impacted. Our revenue is generated through philanthropy from a number of different charities, including Children's Hospital Foundations and other not-for-profit organizations. We also have membership revenues, and the ability of some of our members to contribute their revenue or their membership dues has been significantly reduced. So absolutely, our funding model has been significantly impacted.
Thank you. Ms. Austin.
Thank you for the question. Children First Canada is currently registered as a not-for-profit organization. We applied for charitable status last summer and are still awaiting a decision. And so that in and of itself has limited our ability to secure charitable funding, not only to support our ongoing operations, but also to support our current response to the COVID-19 crisis. We have experienced a drop in overall sponsorship and donations to support our work, and we are grateful for the wage subsidy, which is helping to support our ongoing operations, and also for the recent contribution we received from Heritage Canada, which will partially fund the launch of Young Canadians Parliament. But I can say certainly that we, as well as most of our counterparts across the country, see the need for a stabilization fund for the charitable sector to help enable our organizations to continue our work, not only for the weeks ahead, but for months to come, because the charitable giving will be not only something we experience this month, but we will continue to see the impacts of that for months to come.
Thank you. Ms. Hay?
Thank you for that question. And I do want to echo my colleagues here that the funding need for this sector is critical for the well-being of Canada, for the future of Canada. As far as Kids Help Phone goes, and what I do see for us, we are a long-standing brand. We have long-standing supporters who are standing beside us right now. We have seen a drop in philanthropy for sure, and a drop in community events, lots of participation, lots of volunteer engagement, which I think is a silver lining. But from a financial perspective, in the short term, Kids Help Phone is not worried. It is why when the government provided us with sustainable funding, that we were able to span it out over 2 fiscal years, 1.5 fiscal years. That was important for us to ensure we had sustainability. And I guess on behalf of my colleagues, my peers, I don't think there's a crystal ball as to what's going to happen in the economy. We do know in the charitable sector, we've been a charity for a long time. I'm a former banker who's worked in charity, that one of the last things that people give up out of their disposable income is their charitable donation in tough times. So it is yet to be seen what kind of impact this will have from an economic long-term standpoint. The other thing we do know, which is hopeful, is one of the first things people put back in, including corporate Canada, into their disposable income is their charitable investment. So we need right now the federal government to help charities coast through and come out the other end of this crisis so that we can continue to provide the essential service to Canada that this sector does.